Hello everyone, I'm Jiabao Wu. Today I will present caring for the mental health needs of special populations in primary care. This presentation will cover geriatrics, perinatal women, pediatrics, LGBTQ, and immigrants. As people age, they are more likely to go through adverse events. This will increase their risk of developing mental health disorders. Research shows that 14% of adults aged 60 and over have a mental illness worldwide. In the United States, about 9.8 billion was spent to treat depressive disorders in older adults in 2016. We have some screening tools available for older adults with mental health disorders. Two-step approach to screening. We start with two-question screen or PHQ-2 first. If the patient is positive for screening, then we evaluate patient with PHQ-9. The other one is geriatric depression scale 15. Clinicians should do some lab work to rule out medical conditions such as infection, inflammation, thyroid dysfunction, diabetes, vitamin deficiency, and drug use. Other potential causes include polypharmacy, malnutrition, sleep disturbances. How do we treat the older adults with mental health disorders? The first-line antidepressants are SSRIs. Clinicians should monitor suicidal ideations. For older adults, we start a low initial dose. It may take 8 to 12 weeks to see the effects for older adults. We can refer patients and collaborate with other medical professionals. All mental health disorder patients should have a safety plan. Perinatal mental health illnesses are common complications that occur in pregnancy or in the first 12 months after delivery. The top two conditions are perinatal anxiety disorders and major depression. Research shows that 1 in 7 women experiences major depression during pregnancy or within a year of delivery in the United States. For the 2017 birth cohort in the United States, the estimated cost of perinatal mood and anxiety disorders was 14 billion from the time of conception to 5 years postpartum. We have some screening tools for perinatal women with mental health disorders. Also, clinicians should do some lab work to rule out medical conditions. Other potential causes include malnutrition, pregnancy complications, intimate partner violence, employment and financial issues, and more. How do we treat perinatal women with mental health disorders? The first-line antidepressants are SSRI, such as sertraline. Clinicians should also refer patients and work with other medical professionals. Supportive care includes sleep hygiene, self-care, balanced nutrition, exercise, and more. All perinatal women with mental disorders should have a safety plan. Without early diagnosis and treatment, mental disorders can impact the children's normal development, leading to issues that may persist into adulthood. Research shows that the most often identified mental illnesses among American children aged 3 to 17 were depression, anxiety, ADHD, and behavior issues. For adolescents, depression, substance use, and suicide are the top 3 mental disorders. From January 1st, 2017 to December 31st, 2018, the estimated total annual expenses in the United States related to ADHD were 19.4 billion for children and 13.8 billion for teenagers. We have some screening tools for pediatrics with mental disorders. Initial psychosocial screenings include pediatric symptom checklist 17 or strengths and difficulties questionnaire. There are also some secondary screening tools available. Clinicians should do some lab work to rule out the medical conditions such as infection, inflammation, thyroid dysfunction, vitamin deficiency, and drug use. Other potential causes include malnutrition, medication use, developmental issues, social history like bullies, stressors, family factors, and sleep disturbances. How do we treat pediatrics with mental disorders? The first line antidepressants are SSRIs such as fluoxetine. We should monitor suicidal ideations and behaviors. Clinicians should refer patients and collaborate with other medical professionals. Supportive care includes exercise, nutrition, de-escalation strategies, and more. All pediatric with mental disorders should have a safety plan. LGBTQ individuals have a high risk of developing mental health illnesses because of discrimination, cultural stigma, and limited access to quality mental health services. Research shows that LGBTQ people are twice as likely as heterosexual men and women to develop a mental health disorder during their lifetime. A study demonstrated that the people who identify as transgender and gender diverse have higher rates of being insured than the general public in the United States in 2017. We have some screening tools for LGBTQ populations with mental disorders, include PHQ-9 and GAD-7. Clinicians should do some lab work to rule out medical conditions which causes LGBTQ populations mental health disorder symptoms. Other potential causes include malnutrition, medication use, discrimination, stressors, sleep disturbances, and more. How do we treat LGBTQ populations with mental disorders? The first-line antidepressants are SSRIs. We should monitor suicidal ideations. Also, clinicians can refer patients and work with other medical professionals, including psychiatrists, mental health therapists, case managers, social workers, and more. Supportive care includes balanced nutrition, sleep hygiene, exercise, and more. All LGBTQ people with mental disorders should have a safety plan. Immigrants are vulnerable to mental health illnesses from previous adversity, exposures to a new environment, language barriers, family separations, and barriers to health care services. Research shows that up to 1 in 3 refugees have current depression and/or PTSD, and 1 or 2 out of 10 refugees have anxiety disorders globally. Immigrants pay taxes like US citizens, but they typically have lower medical expenses. They have barriers to health care services, and some individuals cannot obtain governmental health assistance from programs like Medicare, Medicaid. We have some screening tools for immigrants with mental health disorders, such as Harvard Trauma Questionnaire, Hopkins Symptom Checklist 25, Refugee Health Screener 15, Mini International Neuropsychiatric Interview. Clinicians also should do some lab work to rule out the potential medical conditions. Other potential causes include malnutrition, medications, stressors, discrimination, sleep disturbances, and more. How do we treat immigrants with mental health disorders? First-line antidepressants are SSRIs. We should monitor suicidal ideations. Clinicians can refer patients and work with other medical professionals. Supportive care is same as other populations. All immigrants with mental health disorders should have a safety plan. Here is the references I used during this presentation. Thank you for watching. Let me know if you have any questions. Thank you.